Imagine this. It's dinner time and you're about to feed your dog. You pour some food into his food bowl, just guessing the amount as you go. Your dog walks up to you and he starts begging, with those cute puppy eyes of his staring at you pitifully. And so you look at him and you sigh thinking, he's so sad whining like this. Maybe he's really hungry. And you pour him some more food. You might think a little extra food wouldn't matter, but little do you know that this habit might build up into a larger problem, literally. And this is the problem that I, Tessa Lee, will be talking about today. Let's talk about canine obesity. Here's what I'll be covering in this presentation. Firstly, what is canine obesity? Secondly, prevalence of canine obesity in Asia. Thirdly, reasons for the rise of canine obesity in relation to owner's perception of their pet's weight and owner responsibility. Fourth, common health problems in canines related to obesity. And lastly, treatment and prevention of obesity. Firstly, let's define obesity. Obesity is defined by the World Health Organization as excessive or abnormal fat accumulation that may impair health. But how does fat accumulate? Fat accumulates when the number of calories gained exceeds the number of calories burnt. Foods high in fats and sugars tend to have more calories, and when they are not used up through exercise, these calories are stored as fat. During a physical examination of a dog for a regular health checkup, the veterinarian can assess its health in relation to size using the body condition scoring method. The score ranges from 1 to 9, 1 being the thinnest and severely underweight, and 9 being quite obese. The ideal score for a dog would be 4 to 5. If your dog has a body condition scoring of 6 to 7 out of 9, it is overweight, and if your dog has a body condition scoring of 8 to 9 out of 9, it is obese. There are three main factors linked to obesity in dogs. The first is breed. Breeds such as Labradors, Beagles, and Pugs are more commonly seen in clinics regarding obesity. Purity of breed also matters. The purer the breed, the higher the rate of obesity. The second is whether the dog has been spayed or neutered, as dogs that have been spayed or neutered would experience a change in metabolism and loss of hormones, which makes them more susceptible to obesity. The third would be age. A study done by Lund in 2006 shows that dogs from 6 to 10 years old tend to suffer from obesity more than other age rankings, as they could have accumulated unhealthy eating habits over a long period of time and suffer the consequences as they age. Now let's talk about the prevalence of canine obesity. There have not been a lot of studies done regarding the prevalence of canine obesity in Asia. However, a study done in 2013 in Japan has shown that 15.1% of the dogs surveyed in clinics were obese, and a separate study showing 44.4% in Beijing, China. I've chosen these countries because these are closer to Singapore. These numbers are quite alarming, as there are millions and millions of pet dogs worldwide, thus showing that this is an up-and-coming problem, especially in Singapore. Now let's talk about the reasons for the rise in canine obesity. The two main reasons for rise in canine obesity in relation to owners are the dog owner's perception of the dog's weight, as well as their responsibility in managing their pet's weight. Owners and veterinarians often have very different perceptions of overweight. Many owners tend to look at their pets as their children and thus often deny the fact that their pet may seem a little oversized. A study done in 2017 among owners with clinically diagnosed obese dogs found that only 17% of these owners admitted that their dogs were overweight. Veterinarians, however, best understand the body condition of the dog and thus would objectively evaluate the pet. Thus, it is much advised to listen to their feedback. The next is owner responsibility. Since owners are the sole source of food for their pets, it is their responsibility to keep their dogs happy and healthy. This includes, but is not limited to, choosing the right type of food and portion size for the dog, researching the appropriate amounts of food required for the dog's age and breed, as well as ensuring that the pet has sufficient exercise. And why is this important to know? It is important because Obesity can cause dogs to lead more painful lives, becoming more susceptible to illnesses due to their poorer status of health. Dogs with obesity become less energetic and enthusiastic, becoming more reluctant to carry out non-essential activity compared to a normal dog, which causes them to lead unhappier lives. Overweight and obese dogs also live shorter lives. The longevity study shows that overweight Labradors lived 1.8 years less than their leaner littermates. Thus, not only is their life shorter, but they have more associated diseases that affect their quality of life. Common health problems associated with obesity would include osteoarthritis, hypertension, and heat stroke. Osteoarthritis is the progressive loss of articular cartilage due to more strain being placed on them to support a larger body mass. It is more common in geriatric and larger dogs. Hypertension occurs due to increase of fat tissues in the abdomen, leading to increased resistance in the veins and arteries, causing the heart to need to pump harder to circulate blood. Last but not the least will be heat stroke. Fat is insulative, and dogs lack the ability to sweat, thus putting them at a larger risk of heat stroke, especially with the temperatures in Singapore being very warm. With that said, you may wonder, how do I prevent this? Firstly, it would be worth taking note of the following factors when feeding your dog: the way you measure its food, the type of food it's eating, the amount of exercise it is getting, implementing a goal system, as well as other solutions. Firstly, measuring your dog's food. Owners tend to overestimate the portion of food using commercial dry food cups. Thus, an alternative would be to use a kitchen gram scale or a specific portion cup. You could even use a weight measuring scoop to measure specific portions. It would also be a good idea to measure a whole day's worth of food and then portion it to be given throughout the day, such that some can be allocated towards its main meals and few could be spared for a snack here and there to prevent overfeeding. Secondly, the type of food matters. Different types of food vary in amount of calories. Since weight is gained by having a larger caloric intake over calories burnt, it is suggested that you know the breed and age of your dog well, as well as their specific nutritional requirements. Dogs also require a balanced diet to ensure that they have all the nutrients required for them to remain healthy. For weight loss, it is recommended not to starve your pets, but instead start them on diet food pellets. Specially manufactured diet food pellets are usually nutritionally balanced, ensuring that dogs have enough energy, feels full, and yet also lose weight. Recently, I have done a survey amongst young pet owners, and most of the respondents have reflected finding this the most difficult when keeping their pets on a diet. That their pets are incredibly picky eaters and don't want to change their eating habits, especially if they are currently living off unhealthy food like table scraps. What I have learned from an animal nutritionist is that the best way to fix this issue is to slowly introduce your pet to normal or diet food pellets. You would want to start giving your dog less of the food you want to avoid. For example, giving them 75% of the original food and 25% of the healthier food. Then, as time goes by, gradually increase the amount of healthier food and decrease the amount of unhealthier food until your dog has adjusted to the healthier food completely. This process requires a lot of time and patience, as it could take up to months, and thus it is very important to remain determined to fix their eating habits. You also may have to experiment with different brands of healthier food options to see what your dog likes. The third way would be exercise. Dogs are more prone to being overweight if their owners spend little time with them. Additionally, they need to be active by exercising or going for a walk at least once a day. Exercises such as walking them or allowing them to run outside can help to keep the dog in shape and burn off energy from food. This can prevent obesity since it decreases the amount of fat accumulated in the body. The fourth method, and arguably one of the most important for prevention, would be to tie in all three methods I've previously mentioned and to create a goal system. Goals should be set with regards to making habits such as walking the dog 5 times a week for half an hour, or helping the dog to lose 2% of its body mass, etc. You could also research techniques to keep your dog healthy as well as track your dog's weight loss or weight maintenance with charts and planners. By doing so, you can keep track of and establish good habits to maintain the health and happiness of your dog, as well as learn more about the health of your pet. Last but not the least, external solutions. These involve veterinarians, physiotherapists, or animal nutritionists, and such solutions could include physiotherapy such as hydrotherapy, prescription of a diet plan, or even diet supplements. With that, it is unfortunately time to end my talk. Before we end, I would like to give a special mention to my learning facilitator, Mr. Haoting for guiding me through this project. I'd also like to thank animal nutritionist and Dr. Angela Rollins and Dr. Joseph Bartges from the American College of Veterinary Nutrition in ensuring that the content of my talk is accurate. Lastly, thank you to my project mentor, Dr. Haoting Chow from the Singapore Veterinary Association for enabling me to work on this project with them. If you are interested in the topic of canine obesity, you can always come into contact with either an animal nutritionist or visit several websites regarding pet nutrition. Finally, thank you all for listening. I hope that you will keep these in mind before you give in to those puppy eyes and give them an extra serving of food. The health of your pet is in your hands. Thank you.